Hello, my name is Catherine Cerniglia, Director of Performance Management here at Brownville Memorial Hospital. Today I will be instructing you about health literacy and how this topic affects the healthcare experience our patients receive on a daily basis. The key concepts we will cover are patient-centered care and clear communication. What is health literacy? To begin, health literacy can be defined as the ability to access health information that would help patients make informed healthcare decisions. In other words, health literacy is the capacity to understand basic health information and services. Both patients and providers play an important role in communicating health information clearly and understanding it correctly. Practicing clear communication skills to improve health literacy will enable patients to comprehend their health and to act in their own best interests. Key strategies to improving patient satisfaction and delivering patient-centered care are 1. Communicate clearly with patients. This includes using plain language, speaking slowly and clearly while addressing a patient, and avoiding any complicated medical jargon or abbreviations. 2. Respect language and cultural differences. Not all patients speak the same language as their provider. It is important to address these differences and not dismiss them. Utilize the hospital's language access services when applicable. This could be as simple as scheduling an interpreter or a translator to be present during a patient visit, or having copies of any medical forms that are written in several different languages made available to our patients. Clear communication is part of both the provider and patient's responsibility. When patients and providers fail to communicate adequately, both parties will suffer. For the patients, they are actively communicating when they describe their symptoms and express any concerns. They also may need to ask questions, and it is essential they remember clearly any information that is presented to them during a healthcare visit. These are all very difficult tasks that do take a lot of practice. For providers, every day they are presenting new diagnoses. They are discussing treatment options with their patients and administering self-care instructions. All of these tasks need to be completed using clear communication skills. As well as being presenters of health information, providers are also required to be active listeners in order to fully comprehend their patients' needs. There are always barriers to achieving clear communication between patient and provider. Clear communication is challenging when patient and provider lack a common language. The solution to this problem is to utilize language access services and allow interpreters and/or translators to help bridge any language gaps. Clear communication helps to deliver patient-centered care, and respecting language and cultural differences will do the same. This attitude will help patients feel welcome. It communicates a clear health message without any biases. And through mutual respect, we can verify a mutual understanding, while in the end, showing our patients compassion and concern, always. Now we will move to a small group exercise to help us practice identifying common patient signs of poor health literacy and determine ways to practice clear communication. Patient signs and symptoms of poor health literacy, or the red flags we should all be on alert for, are incomplete medical history forms. This may be seen when a patient is given intake documents or insurance forms and they sit with the patient and they don't complete them, and when they're finished and they're returned, they're still not completed. Another red flag is a patient who deflects any or all reading tasks, but they use excuses such as a headache or they have forgotten their eyeglasses. In truth, they may be avoiding the reading tasks because of their low literacy skills. A third red flag is a patient who regularly asks others to read written materials aloud. They may be relying on a family member at home to read for them. And finally, when patients are identifying their medications by looking at the pills, the color and the size, rather than reading the prescription labels, they have actually created a coping mechanism to avoid reading. To begin the exercise, everyone will divide into small groups of 3 to 5 and read through the 4 healthcare scenarios included in your handout worksheets. There are 3 objectives for each scenario. 1. Identify any red flags of poor health literacy. Those are the red flags that we just went over in the last couple slides. 2. Determine if any errors were made by the providers when addressing their patients. And 3. Rewrite the original scenario using clear communication skills. Everyone will have approximately 45 minutes to complete the exercise. There are some important questions to consider while reading through the material. Ask yourself and those working in your group, is my patient exhibiting any signs and symptoms of poor health literacy? What is the best way to respond to the patient's red flags? And finally, are there any services that can be used to aid in communication? To begin, let's work through the first scenario together. Please refer to your handout worksheets. Mr. Smith, an elderly man, was brought into the ER by ambulance and is now waiting to be assessed by a clinician. The patient seems awake and alert, but when addressed by any of the nurses, he responds only by nodding his head and making a few hand gestures. A guest relations staff member has given Mr. Smith some initial paperwork for medical history and insurance, but he has failed to fill out any of the information. The doctor quickly checks Mr. Smith's vital signs and ignores the patient's silence, assuming because of the patient's age he has dementia and is confused by his visit to the ER. The doctor moves right along to the next patient and gives the nurse instructions to contact a care facility and discharge Mr. Smith. He does not present with any critical symptoms. After reading this first scenario and thinking about the doctor, nurses, guest relations staff member, and Mr. Smith's role in the interaction, let's try to answer the 3 objectives. 1. Were there any red flags? Yes, there was. Mr. Smith was very quiet and he only nods his head in response to his caregivers. Also, the medical forms were incomplete. 2. What errors, if any, did the providers make? First, the nurses failed to further engage Mr. Smith when they noticed how quiet and withdrawn he was. And the doctor made inappropriate assumptions about Mr. Smith's age. This was not respectful of the patient. Can we rewrite this scenario using clear communication skills? How would we do this? To start, the nurses and doctor could have addressed the patient face to face in an attempt to connect with them personally. The providers needed to speak slowly and clearly. They could have also used medical forms that were printed in more than one language It is very possible Mr. Smith does not speak English. Instead of dismissing the patient's silence, the providers could have sought the assistance of an interpreter or translator. Maybe Mr. Smith uses sign language. Great work. Now it is time for more hands-on practice. Please form your small groups and continue with the next patient care scenario. When we reconvene, we will discuss the results and share communication strategies. At this point in the presentation, I will give time for all participants to complete their small group exercise. After we come back together, I would conduct a large group discussion, allowing for participants to share their ideas and ask any further questions regarding the 4 patient care scenarios. In summary, let's review the key points of health literacy and how we can use clear communication to deliver patient-centered care. Clear communication is the key to providing patient-centered care. Clear communication includes using plain language, speaking slowly, clearly, and avoiding any medical terminology that may confuse our patients. Use language access services to help bridge language gaps. This includes the use of a translator, an interpreter, and medical forms that are printed in multiple languages, based on patient popularity. Be alert and identify any red flags of poor health literacy. Some of our red flags include incomplete medical forms, patients who deflect reading tasks, patients who identify their pills based on how they look, avoiding reading the prescription labels, and there are many more red flags. Finally, be respectful of language and cultural differences. Thank you for your attention. This is the conclusion of our presentation. This last slide includes all of the references used to develop this training workshop. Again, thank you.